Hello, future nurses. This is Professor Flourish. Today we are going to be doing our dosage calculation. So this is just some slides going over what we learned. Right. Like always, this is our sorry, our approximate equivalents. So these are the ones that, like I said, you're going to want to know. So we've got all the way through here that are your need to know. So all of these ones, because you'll use these quite a bit. The first one we are going to be talking about is our injectables. So our injectables are our things like our intradermal, our subcutaneous, or intermuscular. So intradermal are the ones that go under the skin, subcutaneous go into the fatty tissue, and intermuscular go into the muscle. This right here is just a reference for the maximum amount per site that you can give. So how many mLs you can actually give. So you can give a lot more of your intramuscular than you can give your intradermal. I also put a picture of ampules and vials that basically come from your book, so you can kind of see the difference between the two. With ampules, just remember that you always have to use a filter needle whenever you use this medication. All right, so let's go ahead and get into the math. So with our injectables, our doctor's order, we have a morphine sulfate 5 milligrams IM, which is intramuscular injection now for post-op pain. On hand, we've got morphine sulfate 8 milligrams ml for subcutaneous IM or slow IV use. How many mLs will the nurse prepare in a syringe for a dose of 5 milligrams per IM? So we're doing it based off of mLs. So that's what we're looking for, is how many mLs. So I'm just going to go ahead and circle this here. And then over on this side, I'm going to put equals ml. And remember that we always circle this because this is basically our man in the mirror. Now my circle doesn't look too pretty, but that's supposed to be a little mirror there. So now going back to this problem, what has mLs in it or milliliters in it? Right here, we've got 8 milligrams for every ml. So every time I pull out an ml, I'm going to have 8 milligrams. So that's the concentration of this medication. Now going back, I'm going to put mLs on top using dimensional analysis. And the reason for that is because I want to start with where I'm ending. So I'm going to go ahead and circle that. Because if you look at it, we basically have two little mirrors here. Now underneath it, I'm going to put 8 milligrams. Can I leave it like this? No, I cannot, because I've got this milligrams here. So now in order to get rid of it, I've got up here that has what the doctor's actually ordered me, which is 5 milligrams. So I'm going to put 5 milligrams over here, all over 1. So marking those out. Did I end with my variables being the same? Yes. So now what I'm going to do is 5 mLs, all divided by 8, which will equal, and then pulling out my lovely calculator. Sorry, calculation. I can do 5 divided by 8, which gives me 0.625. So our answer is 0.625. Using our rounding rules, I'm going to round to the 10th place. So right here is the 10th place. That is my 10th place. So whenever you're trying to round, you use the number behind it. So that is going to equal 0.6. And why do I always put this number before my point? I put a 0 before my point, so that way I make sure that I know that it's 0.6 and not 60 or not 6. We can look at our answer, and yes, that's what our answer is. So now our next question, combining in one syringe. So pre-op injection, hydromorphine, HCl, 3 milligrams, and promethazine, 10 milligrams, IM stat. On hand, we've got hydromorphine injectable, 4 milligrams per ml, promethazine, HCl injectable, 50 milligrams per ml. You will need to calculate the dosage for each drug before combining in one syringe. How many mLs will the nurse draw up for the hydromorphine? How many mLs will the nurse draw up for the promethazine? What is the total mLs for the syringe? Now, at first, when you're trying to go about this looks like quite a bit. So what you want to do is break it down. So the first one they're asking me for is my hydromorphine, correct? So I'm just going to hyper focus on my hydromorphine. So I'm trying to find out how many mLs. So I'm looking for equals mLs. So now, since that's what I'm looking for, I need to go back and see here on hand, I've got my hydromorphine, because for every ml, there's 4 milligrams. So we're going to have ml over 4 milligrams. Got my ml here, got my ml here. So I matched the little man in the mirror, but now I need to get rid of my 4 milligrams. So in order to get rid of my 4 milligrams, I'm going to go back up to the top and see that hydromorphine, they ordered 3 milligrams of that. So I'm going to put 3 milligrams up here. Sorry. Nothing wants to register with me right now. Sorry, milligrams up here. There we go. We can put that over 1. Mark those 2 out, and then what I've got is 3 mLs over 4. So using my calculator again, I'm going to put 3 divided by 4, which gives me 0.75. Now for this particular problem, I forgot to put that this is to the hundredths place, so we're going to leave it as 0.75. And so I don't confuse myself, way up here I'm going to write hydro 0.75. Okay, so I've done my hydro. I'm going to put a little check mark next to it. The next one I have, and then we'll go ahead and erase some of this, because we've got our hydro 0.75. Okay, so now I need my promethazine. So again, I'm going to start at the back and do equals mLs So looking at this, promethazine, and our promethazine here. So I'm looking for milliliters. So I'm going to do milliliter over 50 milligrams. And I've got half my man in the mirror. So I've got that man in the mirror, that man in the meter. Can I leave it this way? No, I got to get rid of my 50 milligrams. So in order to get rid of my 50 milligrams, I'm going to come back up and use my 10 milligrams. 10 milligrams here. Over 1, out, out. So now we've got 10 mLs over 50. So using my calculator again, I'm going to do 10 divided by 50. And that's going to give me 0.2. So now I've got my, we'll just put prom. Okay, So we've done both of these, but is that all they asked me for? No. They said, what is the total mLs in the syringe for injection? So both of these can go inside the same syringe. So it's really asking us is what is the total of these two? So I'm going to do 0.75 plus 0.2. Pull out my calculator again. So clear all this out, 0.75 plus 0.2. And that's going to give us 0.95. So the amount of mLs we're going to give is 0.95. Now, with your rounding rules, make sure that you're reading each problem because some of the problems will tell you you need to round this to the 10th place, 100th place, so on and so forth. Some of the problems, though, the beginning of your test will show you how you need to round. So just make sure you're looking at your rounding rules. There's that one. Now let's get to concentration. So concentration, like I said before, is basically the amount of milligrams that are in a milliliter, or the amount of grams in a milliliter. It's just how much of the powdered medication is in the dilute in order to actually create this medication. So looking at this, concentration. Diabetic and ketoacidosis. Start regular insulin drip to infuse at 8 units an hour. On hand, standard regular insulin drip, 100 units, regular insulin, and 100 mLs normal saline. IV pump, IV tubing, glucometer for checking glucose levels. What is the concentration of the solution? Concentration equals units per ml. So what am I looking for? I'm looking for the concentration. So that is my units over mLs. So at this point, do I really need my doctor's order? No, because right now, what I'm looking for is my concentration of the solution. So I'm looking for what the actual box says in the med room. So going here, we've got 100 units in 100 mLs. So I'm going to put 100 units all over 100 mLs. So that matches. My mLs match. Do I need to do anything else with my variables? No, that's as simple as the problem is. I'm just looking for the concentration. So since I have units over mLs, I can do my math. So we're going to do, clear that, 100 divided by 100, which equals 1. So for every 1 unit, there is 1 ml. And that's all you have to do for that concentration. Just make sure that, just like I said, whenever you're doing these problems, start with what you're looking for first. So start at the end of your problem and then go to the beginning of your problem. So that's our answer. So the next thing is our IV pumps. So on here, I've got examples of our IV solution. So in the problems, you'll see lactated ringers, but it'll be called something like LR. Normal saline, 0.9% is going to be something like NS. Dextrose is D5W. All of these, you don't need to do the actual math with. It's just what the solution is called. So these are different fluids that we can give. And these fluids, depending on how our patient's doing, is why we give them. Like a lot of your traumas will receive lactated ringers. For a patient in dehydration, they may receive this normal saline. It all just depends on what's going on with them. Now with it, you can have, because this is what the bags usually look like. So this is an 1,000 ml bag that you would give the patient. And that's basically what it is. I just kind of want you guys to see this. So when you're doing the problem, you know, okay, so this is just a bag of the solution. I don't necessarily need it. The next thing is the equipment. So we've got different equipments. Usually UT will use this one. It's the Plum. Covenant facilities usually use this one here, the one that says vancomycin. Now with it, this is a PCA pump and this is an older PCA pump. Most of the PCA pumps are moving towards this one. This used to be mostly for when we did epidurals, but now we're moving a little bit more towards these depending on the facility that you work at. These ones are like the big boxes, and a PCA just means patient controlled analgesics. So that's what these are all for. So when the problem says pump, this is what they're talking about. And these pumps here are done through, I'll show you. So these pumps here are done through mLs per hour. Actually, let me start. mLs per hour. mLs per hour. So that's the whole reason why we look for mLs per hour. Sorry, that's a terrible circle. mLs per hour, because that's the rate. I want to know how many mLs I'm going to give every hour. Now, some of them might do it weight-based with your heparin drips, but for the most part, if we're trying to set up our fluid, it's going to be that mLs per hour. So let's go ahead and practice these. So our pump infusion rate. So on here, we've got an order for 1,000 mLs NS, so that's normal saline, every 8 hours. Calculate the IV pump infusion in mLs per hour. So we are looking for ml per hour. So looking back at this, I've got 1,000 mLs every 8 hours. So I'm going to put my mLs on top, 1,000 mLs. And I'm going to circle that. I'm going to circle that over 8 hours. I've got hours. I've got hours. Do I need to do anything else with the variable? No, I don't need to do anything else because look, I matched the man in the mirror. So now the next thing I'm going to do is my math. So we've got 1,000 divided by 8. And that gives us 125. 125 mLs per hour. So every hour, the patient is receiving 125 mLs. Okay, so our next one, pump infusion rate. 1 liter D5.5 normal saline to infuse over 12 hours Viva pump, mLs per hour. So I'm looking for ml over hour. So going back, do I need this D5 over 1/2 normal saline? No, that's just telling me what type of solution this is. So we're looking for mLs, but I only have a liter here. So using my equivalents, we got 1,000 mLs for every liter. So that's 1 liter. Then multiply that by 1 liter. 1 liter. That looks awful. Let me erase that real quick for y'all. Okay, so we've got 1 liter here over 12 hours. Do I have the variables I need after crossing him out, I've got ml, I've got hours. So these two have their date to the dance, and then these two are matching the man in the mirror. ml over hour. Do I need to do anything else with my variables? No. So now this is going to equal 1,000 mLs all over 12 hours. So let's go ahead and do our math. Okay. We'll clear that off. And then we've got 1,000 divided by 12. And that gives us 8.333333 repeating. Now in math, what you can do is if you have a repeating, you've got 83.3 repeating like that. However, with these, I would follow your rounding rules, which is going to be to the whole number. So that is 83 mLs per hour. And you really want to do your rounding based off of what they tell you in the problem. Now, for our quiz purposes, we won't necessarily tell you in the problem, but we'll have a list of rounding rules. So just make sure you're checking your rounding rules before you submit your paper in, because this one will be wrong. It has to be that whole number. Okay. So now we're trying our challenge question. The doctor writes an order to infuse a solution. The order reads infuse 2 liters at 150 mLs per hour. How long will it take for the infusion to complete? So what am I looking for? I'm looking for time. So I'm going to put time here. And on here, what has time? Hour. So I'm going to put equals hour back here. So I've got 2 liters at 150 mLs per hour. So I'm going to put hour on top because that's what I'm looking for, over 150 mLs. So I've got my man in the mirror. Got my man in the mirror. Uh-oh, I brought a friend to the dance. So now I need to get rid, oops. So now I need to get rid of my milliliters. So on here, what do I have that I can use equivalents for? Yes, I can use my liters. So I'm going to put 1,000 mLs over 1 liter. Okay, so I got them a date to the dance. Uh-oh, I've got this liter. So now I can go back to the problem because it's 2 liters. So we put 2 liters up here over 1. Does everybody have a date to the dance and I match the man in the mirror? Yes. So now we can do our math. So 2 times 1,000 is going to give me 2,000 all over 150. And then let's see what that gives us. So like I said, 2 times 1,000, which gives us 2,000. And then we're going to divide that by 150. And that gives us 13.33333 repeating. So we're going to write 13.3 repeating. So we know we've got 13 hours and how many minutes. So if you remember what I said, to the 100th place is our percentages. So if you want to find what this is actually 30%. So it's 33%. So we're going to put 33% of 60. Why is it 33% of 60? The reason it is 33% of 60 is because they are 60 minutes in an hour. So since this is behind the decimal point, this is telling us that there's 33% of 60 minutes. So finding our percentage, we are going to do 0.33 times 60, which gives us 19.8. So that's going to go ahead and round up to 20 minutes. And 20 minutes. And that's the answer to it. All right, so let's try this one. The nurse has an order to infuse 1 liter normal saline at a rate of 150 mLs per hour. If the infusion started at 9:30, what time will it be completed? So looking at this problem, what am I looking for? Yes, I'm looking for time again. So if I'm looking for time again, I'm going to go back here. Oops, sorry, and put equals hour. Okay, so on here, what has hour? Right there. So I'm going to put hour over 150 mLs. Can I leave it that way? No, I cannot. So now I need to get rid of mLs. So now we've got 1,000 mLs all over 1 liter. And then this one here, in order to get rid of our liter times 1 liter. Was I left with hour? Yes. So let's see what 1,000 divided by 150 is. So clearing this, we've got 1,000 divided by 150. And that gives us 6.66666 repeating. So our answer is 6.6 repeating. So that's 6 hours. And remember, we're going to do our percentages. So let's go ahead and try our percentage. Let me find my handy dandy calculator here. Okay. I don't know why it's so big right now. Let me see if I can make it smaller for you. There we go. Okay. So looking at this, so since this is 0.66666, I'm going to round that to the 100th place where I get 0.67. So it's 67% of 60. And that gives me 40 because we're going to round that to the whole number. Okay, so that is 40 minutes. Can I leave it this way? No, because it asked me what time will it be completed. So since it's asking me what time it'll be completed, I'm going to add 0, 9, 30, 100 plus 640 because we use military time. So 0930 plus 640, and that gives me 1570. How many minutes are in an hour? 60. So that is actually going to be 16. And then what is 70 minus 60, which gives us 10. So 1610. So that infusion is to be completed by 1610. So that is our finish time. And those ones are usually the ones that will be the hardest when it comes to this, is figuring out your infusion times. My suggestion is first find out your mLs per hour, and then it makes it much easier when you're trying to find out when the solution is going to be complete. So the next thing we're going to talk about is our drop rate. So once again, I kind of like to show you the equipment here. This is our equipment. So we've got here a gravity flow intravenous infusion. So on it, you usually have the needle adapter and protective cap. So that's what actually connects in with the patient. You've got a secondary port. So if you want to put in a flush medication, you can. Up here, there's usually a filter and then a rolling cap. So you use the rolling cap to control how many drops per minute you have. On here, this little chamber is what you actually see when it comes to your drops. So you'll count those. Most of them will have on the solution site, they will have on the bag how many drops. So for example, on this one, it's 60 drops per mLs. So that is a micro drip. Now, the only time in these problems when they won't show you, and this is just a better picture of it, the only time in these problems where they won't give you the drop factor is if you're dealing with a micro drip. A micro drip only comes in that 60 drips per mLs, and that's usually written in the problems as, as MCGTT. So it's telling you it's a micro drip. And that one is just the implied 60 drops per ml. The other macro, which is what we usually deal with, can come from anywhere between 10 to 20 drops per ml. Okay, so let's go ahead and work on these problems. So our first problem, we've got doctor's order infusion D5W 1,000 mLs over 8 hours by gravity tubing. On hand, we've got D5W IV fluid 1000 mLs, IV pole, IV tubing with drop factor of 10 drops per mLs. How many drops per minute will the nurse set the gravity drip rate to infuse the 1000 mLs in 8 hours? Drops per minute. So what we are looking for is our drops per minute. Now going back to this problem, what can I use that has drops already in it? Yes, I'm going to use my drop factor. And remember, it'll always give you the drop factor unless it is a micro drop. So I'm going to put 10 drops over ml. And then that has this. That's my drops there. Can I leave my problem this way? No, I sure cannot. Now here we've got 1000 mLs over 6 hours. So we're going to put 1000 mLs. Sorry, my pen's not wanting to work right now. Over 8 hours. So that gets crossed out, that gets crossed out. And now I've got hours here. Is hours the same as minutes? No. So now I need to get rid of minutes, get them a date to the dance. So we've got hours up here over 60 minutes. Hours. Was I left with drops over minutes? Yes, I was. So now I'm going to do 10 times 1000. So we'll pull out my calculator. Clear that off. We've got 10 times 1000, which gives us 10,000. So we'll go ahead and write that down. So we've got 10,000 drops all over 8 times 60, which is 480. Okay, so now let's do 10,000 divided by 480. So that gives me 20.833333. Now with these drops, can I have part of a drop? No. So drops are always to your whole number no matter what. So that's actually going to equal 21 drops per minute. And that is my answer here. Okay, so let's try this next one. The order is 2000 mLs D5W IV infused in 6 hours. The drop factor is 15 drops per mLs. Calculate the flow rate in drops per minute. So what am I looking for? I'm looking for drops over minute. So on here, what can I use? I'm going to start with my drop factor because that has drops in it. I'm going to put 15 drops over ml. So I've got the man in the mirror here, but I've got a friend, so we need to get them a date to the dance, right? So what can I use that has milliliters? Yes, 2000 milliliters over 6 hours. Mark out, mark out. Can I leave it this way? Nope, I got to get rid of 6 hours. So I'm going to put an hour over 60 minutes. So that's my date to the dance, or sorry, that's my man in the mirror. They've got their date to the dance. And can I start doing my math? I sure can. So let's see here. So now we've got 15 times 2000, which gives me 30,000. So I'm going to write 30,000 here. Then I've got 6 times 60, which gives me 360. So I'm going to go ahead and write 360. So now we'll do what is 30,000 divided by 360. And that gives me 83.33333 repeating. 83.3 repeating. Can I have 83.333 repeating? No, I have to round to the whole number. So that's going to give me 83 drops per minute. And that is my answer here. Okay, so now we'll go to the next one. This is our challenge question. An IV is infusing at 45 drops per minute. If the drop factor is 15 drops per mL, what would the rate of flow equal in mLs per hour? So now we're converting it to mLs per hour. So what am I looking for? I am looking for mLs per hour. So this is going to be equals mLs over hour. So now what has milliliters in it? Once again, I can use my drop factor because it has that lovely milliliters. So we're going to put milliliters on top because in math you can do the flip-flop over 15 drops. So I've got one of the man in the mirror, but now I need the other one. How am I going to get rid of drops? I can use this here. Drops over minutes. So now that's 45 drops over every minute. Marked out drops, marked out drops. Am I done yet? No, because it wants hour. So I can input 60 minutes up here, all over an hour. So they've got a date to the dance, and now I am matching the man in the mirror. So looking at this, we're going to do 45 times 60, which gives me 2,700. Over 15. So 2,700 divided by 15, which gives me 180. That's going to equal 180. So there's 180 mLs every hour, and that's my answer. And that's pretty much what you got to do with those ones. Now, the next one is our body surface area. So our body surface area is the only one where you're going to have to actually memorize these formulas. So in order to find, so body surface area is represented by m squared. So m squared is weight, kilograms times height over 36, and then weight of pounds times height over 31. So the way I always remember this is in Europe, they usually use kilograms and centimeters, correct? So when you think about it, you want to travel to Europe before you turn 36. So that's just how I personally remember it. Then with height and weight, Baskin-Robbins has 31 flavors. So I'm going to use pounds over inches. In the child's dose, you have to have the child's dose of the BSA over 1.73 times a normal adult dose. Okay, so looking at this, we've got your patient weighs 180 pounds and is 6 feet 2 inches. What is the patient's body surface area? So looking at this, we've got pounds and we've got feet and inches. So which one should we use? 31 or 36? So these are the American ones. There's 31 flavors. So I'm going to put square root 180 pounds times, so 6 feet. So I'm going to have to convert feet into inches. So over on the side of my paper, I can do 6 times 12. And why did I do 6 times 12? Because there are 12 inches in every foot. So 6 times 12, which gives me 72. So over on the side here, I'm just going to write 72, and then there's also 2 inches, so plus 2, which is going to give me 74. So times 74 inches all over 31, 31. So pulling out my calculator, I'll show you how to put this in. So what I say is, to make it so you know that you have to do this first, you can put parentheses all around this, because you have to do the math in here before you square root it. So we're going to have 180 times 74, which gives me 13, 30, 20 divided by 31, 31, which gives me 4.25, all of these numbers. And then I'm going to square root that, and I get 2.06. Now, usually with your body surface areas, we go to the 100th place. So that's going to equal 2.06 m squared, because that's my body surface area. Because the reason we do body surface area is because with our pediatric doses, we don't usually give the same amount that we would give an adult. So you have to do it more based off of how much body they have, opposed to just giving that standard dose. Okay, so now we've got this one. Your patient weighs 30 kilograms and is 93 centimeters. What is the patient's body surface area? So look at this. We're using kilograms and we're using centimeters. When do we want to travel Europe by? That's right, before we turn 36. For any of us who are no longer 36, well, what you gonna do about it? So we've got 30. We've got 30. Ah, dang it. Sorry, my pen's not wanting to work with me. We've got 30 kilograms times 93 centimeters, all over 3,600. I'm going to put a parentheses here and a parentheses here to remind me that I have to do the math on the inside first. Okay, so pulling out my calculator, I've got 30 times 93, which is going to give me 2,790, divided by 3,600, which is going to give me that 0.775. I'm going to square root that, and it gives me 0.88034, keeps going on. So with this, what do I round to? The 100th place. So it's going to be what? Yes, 0.88. So it's going to equal 0.88 m squared. And that is my answer there. Okay, our challenge question. A pediatric patient is ordered a medication dose of 100 milligrams for every body surface area, so m squared a day, by mouth for 5 days. The patient weighs 55 pounds and is 4 feet 5 inches. What is the daily dose of medication the patient will receive? So looking at this, we're using pounds and we're using feet and inches. So which one are we going to use? 31, 31, exactly, because I need to find this before I can start putting it into dimensional analysis. So using my square root, put this and this. I know that's the American one, so I'm going to write 31, 31, and then I've got 55 pounds multiplied by, so 4 times 12. So let's see here. 4 times 12, which gives me 48. And then how many other inches did I have? Plus 5. So that's going to be 53. So I've got 53 here. So I need to find that first. So we've got 53 times 55, which gives me 2,915. Divide that by 31, 31, and that gives me that 0.931, all that jazz there. I'm going to go ahead and square root that, and that gives me 0.6488. So I'm going to round to the hundredths. So that is my 0.96. So m squared equals 0.96. Now going from here, I can do my dimensional analysis, because what am I actually trying to look for? What is the daily dose of medication the patient will receive? So I'm looking for milligrams. So we can just do dimensional analysis. So I'm going to put equals milligrams here. Sorry. So when I'm looking for milligrams, I'm going to put 100 milligrams on top over m squared. And this is just 0.96 over 1. So that's a date to the dance, date to the dance. So now it's just 100 times 0.96. Now what I personally do is I leave this whole number in here when I'm trying to find it, just because I don't want to mess up my pediatric dosing. So it's going to be times 100. And that gives me 96.4889, all that jazz. So then your answer is going to be 96. So the amount of milligrams I'm giving every day equals 96. So we are giving 96 milligrams. Okay. So now we are doing our next challenge question. A pediatric patient is 39 pounds and is 3 feet 2 inches. The physician orders an oral medication that is a normal adult dose of 300 milligrams. How many milligrams of this medication will be administered to the patient? So remember, since we're doing the adult dose here, then we have to use that formula we had. So that formula is our child's dose equals child's BSA over 1.73 times adult dose. Oops. Okay, so first let's find our BSA. So our patient is pounds and feet in 2 inches. So which one are we going to use? Yes, 31, 31. Oh, sorry. Okay, so we've got that 31, 31, and then we've got 39 pounds times, so we'll do 3 times 12. So 3 times 12, which gives us 36, plus 2, which gives us 38. 38 inches. Okay, so now we'll do our calculations. So we've got 38 times 39, and then divide that all by 31, 31. And that gives us 0.473312, all of that. I'm going to square root it, and that gives me 0.687999, all of that. So that's going to give me 0.69. Now putting this in my formula, that's my body, that's my child's body surface area. So 0.69 is going over our 1.73, because that's the number we use for it. And then what is the adult dose? So my adult dose is 300. So I'm going to do that times 300. And let's see what we get. Okay, so we can divide that by, like I said, keeping our same thing in our calculator here. We can keep all these numbers here, divide that by 1.73, and then multiply that by 300. And that gives us our 19.3. milligrams. So we're going to give our child 119.3 milligrams unless we are rounding to the whole number. So that's going to be 119.3. All right. And that is our answer. So if you have any questions, please do not hesitate to message me, and hopefully this was helpful. Thank you.